Hi, thank you so much for joining me. To anyone that's ever attended one of my trainings in the past, you know that I tend to give a lot of nuggets, so I'm actually going to keep this really basic an introduction into the pelvic floor dysfunction and one assessment tool, and then I'll post later two workouts based on that assessment. So it's very basic. It's just more or less to give you an understanding of the anatomy, the physiology, what happens in the pelvic floor. Remember again that symptoms are simply a resultant, so they're not necessarily the cause of what's happening, but more an indicator that we need to be curious and to look at why this has come about. So remember, these are just my opinions. This is not in any way something that you can use as a diagnostic tool or to not see a health professional. So if there's something that you're curious about or interested in or worried about, then you should be seeking the proper medical advice. So this is very basic, just a beginning of taking a look at the pelvic floor. And again, these are my opinions, so remember to stay within your own scope of practice. So thanks again for joining me. So let's talk first about my background. I'm a manual osteopathic therapist. I specialize in obstetrics and pediatrics. I'm a registered massage therapist. I'm also a master Thai massage practitioner. I'm a master yoga trainer, registered yoga therapist. I teach yoga teachers and yoga therapists. I teach post-traumatic stress courses, anxiety, the nervous system, how the neuroscience of yoga. I'm a neurolinguistic practitioner, a lifestyle coach, a holistic nutritionist. I've been in the fitness industry for over 30 years, a personal trainer, uh, everything it seems that is related to that holistic health, healing process or program. I have studied it or learned about it. So my background is very unique. I come to you with a lot of different perspectives. Anything I've learned is that in learning all of these, there's always a bigger picture. So it's never as simple as one thing, one size fits all. It's truly dependent on the anatomy and the participant. So let's move ahead and see what we are looking at here today. So these four principles are our governing principles of osteopathy, but I feel that, quite honestly, they are a great way of approaching the body. So we understand that the body is a unit. Nothing works independently. We have our mind, body, soul, and that all three of those have to meld together to give us a body that's in good working order. Structure governs function. So only 60% of the body is muscles and bones. We also have 30 feet of intestines, 60 miles of blood vessels. We have the heart, the lungs, multiple organs, our sex organs, connective tissue. The fascia is continuous throughout the entire body, creating chains, covering every muscle, and then integrating into those muscle fibers, covering every organ, allowing them to move smoothly one on the other. And they also serve as a neural pathway, so bringing the connection of those muscles one to the other. So the the body um, there are so many different levels to look at. So the body is its own medicine chest. It has within it everything that it needs to heal itself. And so it's by the loss of motion of fluid through the body, whether that's nerves, veins, lymphatics, arteries, the loss of that is going to cause disease. And then we say that the rule of the artery is supreme because the artery not only removes toxins from the body, but also brings nourishment to the body. So if that's occluded at any point, then we're going to look at a body that cannot self-regulate or self-heal. So that is our whole goal, to find what's not moving and add movement back in, because we know that as long as things are moving, depending on or irregardless of what that looks like to us. As long as things are moving, the body is taking care of itself. So the core training, core stability, core strengthening. Everyone's heard of the core. We're all familiar with that term. However, not everyone is familiar with the right approach to core exercise. And not only that, but most fitness professionals included don't even know what the core really is. So it's more than just our abs and our back. The true inner core is made up of four supporting muscles that work together. And when they're functioning optimally, synergistically, they support the spine and the pelvis, and they have an important job to create interabdominal pressure, to move fluid through, and to create peristalsis. So those four are the diaphragm, the pelvic floor, the transversus abdominis, which actually melds at the linea alba, wraps around, integrates into the fibers of the obliques, and then into that big thoracolumbar fascia, where it attaches, along with a few other muscles, most importantly the multifidus, to the lumbar spine. And so those, when they all work synergistically together, they not only help create stability, they actually anticipate movement. It's called an anticipatory response. And so when they're all working correctly and together, they create that support and strength that the body needs to move. So to understand this on the next level is to understand how the strength of the pelvic floor is actually affected by the respiratory diaphragm and also the oral diaphragm. So let's look at those connections. So here are the muscles of the core that I was just talking about. We're looking at our transversus abdominis, which wraps all the way around. It's kind of the container, the innermost unit of the abdominal muscles. The multifidus that align along the spine and create stability and support. The pelvic floor muscles, which are like a slight trampoline. I mean, um, the pelvic floor is slightly domed, not as domed as the respiratory diaphragm, but there is a slight dome to it. And so with the respiratory diaphragm and the pelvic floor, they work with recoil. So they compress one on the other to give our internal organs a little bit of a hug and create the motion, the peristalsis that we need to be happening on the inside. So the pelvic floor is a collection of muscles, nerves, tendons, blood vessels, ligaments, connective tissue, and they're all interwoven with the pelvis, and together they make up the pelvic floor. Now those muscles attach all the way from the pubic bone back to the coccyx, to the sacrum, and then side to side, more transversely or longitudinally, they attach from ischial tuberosity to ischial tuberosity. And so they create the support, the strength to keep all of those pelvic organs in place and help us maintain our continence. And they need endurance to work together for long periods of time, such as to hold on to our continence throughout the day. They need to be able to contract quickly and strongly at various times during the day, such as when we laugh, when we cough, when we sneeze. So that's that anticipatory response that I told you about. In a properly functioning pelvic floor, that contraction is autonomic. And it happens before we actually move, cough, or sneeze. And it's when dysfunction is present, it creates the inability for it to contract fully, or sometimes it's neurological. It's the timing of the contraction that may be the issue, or even the inability to relax. So it's a very complex part of our core, and we're just touching on the edge of what may be going on in our core. So the pelvic floor is made up of three groups of muscles, and they work seamlessly together. When they do, it's like an incredibly strong elastic trampoline, and it creates a hammock of sorts. So it's holding together all of the organs in the pelvic floor. But those important muscles, not just as a support group, but they also act as though they're a sump pump. Their rhythmical pumping is coordinated with respiratory diaphragm to help circulate blood and lymphatics, so it doesn't congest in our pelvic region. So just like when we um, have swelling in our ankles when we sit all day, the same thing happens in our pelvic floor when we sit all day, and that musculoskeletal contraction isn't happening to help that fluid move through. So that pelvic basin actually becomes swollen with fluid when we sit too long. So there's a special area between the genitals and the anus, and that's called the perineum. And though it's not specifically a muscle, it certainly acts like one. Anatomically, it's called a central tendon because it's the connecting area for several muscles of the superficial and the intermediate layers. And although it's only an inch in diameter, the perineum is also the true center of our torso. It actually creates our equilibrium in our body. So energetically, it is a place that connects the soles of our feet, the arches of our feet, and the inner thighs of our legs to the pelvis. So that's why we say that we can feel the contraction of our pelvic floor when we pull up through the arches of our feet. Technology. All right. So the sacrum and the coccyx. Anyone that has had SI joint pain knows that there is motion between the ilium, those two hip bones on either side, and the sacrum. And it is the triangle that sits at the base of the spine and the covering for many delicate nerve endings and vascularity. The motion of it gently rocks to allow the dura to pull, and that pull moves cerebrospinous fluid through that narrow tube. It's a lot more complicated than that, but that's the easiest way to explain it. And so that cord comes all the way to the base of the skull and then into the brain and allows that motion. So that's why we need good motion through the sacrum. The coccyx, despite how small it is, it's actually really important for so many reasons. So many muscles, ligaments, and tendons attach here. And it also provides positional support for the anus. And now, because of the amount of sitting that we do, unfortunately, it has become, or it has become, weight bearing. So that structure of that bone was not meant to bear weight, especially not for long periods of time. And so for the health of our spine, we should not be sitting on it. I often say that sometimes the coccyx can be slightly moved to one side or the other, depending on how we sit all day long or the motions in our life, or it could be a fall on our bike when we were 10. The thing is, the body does not like when things are out of place, even the smallest amount. So I often liken that to a raspberry seed between your teeth. If you've ever had something stuck between your teeth, how much discomfort, discord that gives you until you're able to release it or move it out, and then how much relief you physically feel through the rest of the body. So the same thing when the coccyx is slightly out, one side or the other, it can create quite a sensation of discomfort through the rest of the body, and that is acutely felt by the patient. So these are the organs in the pelvic bowl. This is the side profile of a woman's pelvis. And I'm just going to go ahead so that we can see that whether it's a woman's pelvis or a male pelvis, uh, that side view is very much the same. So those organs, the bladder in a woman, the uterus, the bowel, in a man, the bladder and the bowel, the prostate, those organs are constantly negotiating and renegotiating their space. So as they fill and as they empty. And the organs have ligaments that help to suspend them and lift them off the pelvic floor. So they're kind of just above so that the sphincter is coming through, but the weight of those organs are not pressing down on the pelvic floor. So there's elastic recoil, but also the ability in the pelvic floor to relax, to allow these sphincters to open. The anal sphincter itself is so sensitive that it's actually able to discriminate between solid, gas, and liquid. And that sensitivity is no small thing. So if they are unable to stay suspended, they then press into the pelvic floor. And then at that time, they lose the ability through that brain reflex connection to know when to open or close. And they become stuck in either direction, stuck open or stuck shut. So let's talk about those three domes. We can see them here. So this is the best example I've been able to come up to with, so the oral diaphragm right there at the very top. Then we can see our respiratory diaphragm and then the pelvic diaphragm. And we can see how these layer one on the other. So just as we can influence our heart rate by taking a deep breath in, we can consciously control a great number of processes that directly influence our breathing. We can actually improve our pelvic floor health by becoming more aware simply of our breath. So you've probably all heard of the butterfly effect, how something as small as the flapping of a butterfly's wings can cause something as big and powerful as a tornado. So every system affects the other. The crazy thing is that a wide dome in the mouth, so at the roof of the mouth, can actually affect the pelvic floor. So here's where things get really interesting. The roof of the mouth, the hinge of the jaw, and the roof of the tongue are all connected to the pelvic dome, both energetically and through fascia. The body oscillates through the bones. Hence, if you grind your teeth at night, this can be an indication of excess tension in your pelvic floor. Or a bound mouth can contribute to that excess tension in the pelvic floor. What matters is that all the domes of the body are able to talk to each other and communicate. And when they move together in synchronicity, when one dome is happy, the others are happy as well. So I'm just going to read to you a short bit here that I have. So the roof of the mouth is just one of the domes in our body. And we have domes from top to bottom. The arches of the feet, the pelvic floor, the respiratory diaphragm, the cervical diaphragm, the palate, and the cranial diaphragm. Ideally, in a healthy body, these domes or diaphragms move in unison. Our breath moves the respiratory diaphragm, whose movement then affects all the other domes in the chain. In theory, the dome widens on inhalation and narrows on exhalation, creating a fluid, full range of motion dialogue. So when the lungs fill with air on an inhalation, a whole lot of things start happening. For one, the diaphragm moves down, flattening its dome-like structure, and in the process, it pushes the organs below. With each breath, the diaphragm changes the shape of our organs. But as the diaphragm moves down, it also allows the lungs and ribs to expand in what is known as circumferential breathing. So all these processes have an immediate impact on the pelvic region. So a healthy pelvic floor lifts in response to the transverse abdominis contracting and then aids the transversus in exhalation while stabilizing the organs. So we can see, considering that we breathe between 17,000 and 20,000 times a day, our pelvic health depends on good breathing. So important to understand. That's through pelvic liberation. Let me see, where can I show you? Amazing book. All right, let's move on. So there are different variations of diastases. We can see that here. So I'm going to do a whole talk just on diastases so that we can go through and understand that a bit better, because I need you to understand, first of all, how to know, do I have one? Childbirth can cause it. We know that the linea alba, which is that white lining that attaches from the xiphoid process to the pubic bone, we know that it opens in childbirth. So did it come back smoothly or not? We also know that just if we have forces on that, so a bodybuilder because of the amount of force that they're constantly pressing and building those muscles can create a separation in that linea alba, a diastasis of sorts. A hernia is actually just a variation of a diastasis. Um, so I'll make a short video on that, on how to check, how to bind, what exercises we should be doing and not, because we should not be doing crunches. How this affects digestion, how the diaphragm actually is pulled down from the pelvic floor. And so what ends up happening in this particular case when we have a diastasis is that now we have lost the integral support of the respiratory diaphragm with the pelvic floor. So we're looking at digestive issues, constipation, or it could go the other way. We could end up with irritable bowel, the inability, reflux, the inability to draw fluid down through that um, through the diaphragm. So there are so many different things. And then this can, because of the lack of tonicity at the front of our body, remember I said that the transversus wraps around and attaches through the thoracolumbar to the lumbar spine. So maybe now we're looking at chronic back pain, disc issues. So all of these things are interrelated. But most importantly, what I want you to know is if you know that you have a diastasis at this point, I don't want you to attempt the exercise that we're going to do next, because that will be a whole other video. So instead, I want you to wait until I post up the small short clip that I'm going to do on the diastasis and what we need to look at when it comes to that. All right, so let's move on to our exercise so that we can see where is the dysfunction in our pelvic floor. So first of all, you need a balloon or you need something to blow into. A sandwich bag could even help, I think. So first of all, we need to look at what is the goal. So in doing this particular exercise, what we're going to be looking for is where is the dysfunction in the pelvic floor? Is it the actual pelvic floor? Is it the respiratory diaphragm? Is there a loss of tonicity somewhere on that line that's causing the dysfunction in our pelvic floor? So we need to understand, where does the air go when I push out? So that's the goal. What I want you to look for is the sensation that you feel when you first push. So do you feel as though the air gets trapped, can't go past the diaphragm? Are you able to blow even out, creating that external pressure? Or do you feel pressure in the pelvic floor? Do you feel rebound in the pelvic floor when you blow out? Or do you feel the urge to urinate? So remember, this is just one tool. All we're looking for is what information does this give us. So I want you to take a moment, blow into your balloon, and then take a moment to note down how it made you feel. Perfect. All right, so this exercise, all it did was help us to gain an awareness of the different muscles that were brought into play. What I wanted you to do was observe what happened in the pelvic floor region when you blew into the balloon. So here are the things that you might have noted: that the act of the blowing into the balloon caused the urge to urinate, or that the pelvic floor was being pushed downward, or conversely, that the region was contracting strongly in upon itself and even maybe moving upward. So what happened? To inflate a balloon, you have to blow in air under pressure. And to create this high pressure, the abdominal muscles contract, pulling in the abdominal and pushing it in part upward and toward the thorax. However, part of the pressure moves downward and compresses not just the thorax, but the perineum. So if the pelvic floor has weak muscular tone, this pressure will be enough to bring on the urge to urinate. If the pelvic floor muscles have sufficient tone, they will be able to control the urination, in which case you may simply feel the muscles contract more or less downward. Alternatively, If the pelvic floor muscles have strong tone, too much tone, they will play a different role. They will join the abdominal muscles in creating pressure that moves upward to the thorax. So those are the three possible responses to doing this exercise. So weak muscular tone, I'm going to say, is hypotonic, not enough tension. Now, too strong of tone, we're going to call hypertonic, too much tension. So let's move on. So in a hypertonic pelvic floor, remember the muscles are too tense and unable to relax. And there's so many reasons this could happen. It could be from holding in the flow of urine too often. It could be from doing Kegels incorrectly or too often again. What it ends up causing, though, if we look on this side thing with those red areas, it can cause trigger points or referral pain in these particular patterns. So you might feel pain on the outsides of our hips, pains on the insides of our thigh, chronic low back pain. All of those things can be caused by a hypertonic pelvic floor. It can cause constipation. It can also cause irritable bowel. So let's move to the next one. A hypotonic pelvic floor, as we see in our small picture right there where the pink is one that has not enough tone. So there's not enough support for the bowels, the bladder, or the uterus. So, or the prostate. And so because of that, these organs are pressing down into the pelvic floor. Over time, it can cause a prolapse. But remember what I mentioned before about the sphincters and their ability to be able to read when they need to open or close. So they have now lost the ability to do that. So I'm going to do two workouts, one for hypotonic and one for hypertonic, just short 30-minute flows. And if you found that either one of these, hyper or hypo, are where you fit in, you're just going to click on the appropriate one and do it every 3 days. But the pelvic floor can also be too tight and too loose, a combination of both. So that's why this is simply one tool, and it's just a beginning, and I'll be posting a whole bunch of different things for us to look at, but this is just one aspect of what could be happening in the pelvic floor. So where is our center of gravity? This is actually really important because remember I mentioned that the perineum is kind of like the middle of the body. So where are we in the spectrum? Are we ahead of our center of gravity, compressing down into the pelvic floor, making too much of a contraction between the diaphragm and the pelvic floor, pushing things through too quickly, causing an irritated bowel or a revved up metabolism? Or are we behind our center of gravity? So, and being behind our center of gravity, not enough tonicity, losing the ability for peristalsis. And in this case, usually we see things like acid reflux, the inability for the diaphragm to push all the way down. Or we could be side bent, more on one side or the other, depending on what we do in life. And so are we compressing more down on the transverse colon, or are we pressing more down into the sigmoid colon? So a lot of different things to be looking at. Remember, I said we're just touching the tip of the iceberg. So we can see when we look at the skeleton how this would cause dysfunction within, if we just look at the bones, not even imagining the structures that are around the bones, right? So the muscles and the tissues and the nerves, veins, arteries, and lymphatics, we can see how if we're in a kyphotic position, how that would compress the internal organs, how it would change the orientation of the pelvis. And then everything connects to the pelvis, whether it's up or down. And that takes us into that should I stretch or should I strengthen thing, because we need to look at why are muscles on tension. Uh, do we feel the need to stretch because they're already too stretched, right? They're stretched as tight as they could be. And so that's creating a sense of tension. So all of these things deserve a closer look. And then we can see how, so if we're looking at a side bend, what are the organs that are being affected? Can we see how tightly and closely everything fits together? The body abhors space. There is no space in your body. So everything fits perfectly, one on the other. And those systems all work synergistically to allow the health of the body. And then we have to look at our anatomy trains. I mean, there's that superficial back line that connects the bottom of the foot to the forehead. There's the superficial front line that attaches the forehead to the top of the foot. There's that deep front line that comes through the bottom of the foot, the lateral portions of the lower compartment of the leg, behind the knee to the inside of the thigh, to the hip joint, through that psoas muscle, into the pelvis, running up one side of the line to the base of the cranium, but then there's also the line that starts at the pubic bone that goes to the xiphoid process that runs under the sternum and comes all the way to the chin. So we need to look at how are all these affecting the whole, their role in surrounding and supporting the heart and the lungs. And that has a significant effect upon respiration. And remember, we said that it's how the respiratory diaphragm moves that's creating that synergy with the pelvic floor and the oral diaphragm. And this is again just that deep front line so that we can see how they move. So in osteopathy, we say base out, center up. If we align the body starting at the pelvis, we are allowing the body the opportunity to self-heal and self-regulate. And the goal is to find the health of the body. And by expanding on that, we allow the body the opportunity to heal itself. Ultimately, your body's doing all that it can to create stability, and it's doing a great job. So we have to look at those things. So thank you so much for joining me. I hope that this gave you a small bit of awareness or at least a different perspective into your pelvic floor. I'll try to answer as many of your questions as I can. I am going to put together maybe a Zoom course where I can deal with smaller groups of people, and then we can branch out and have discussions and go further into the information that I know is the meat and the bones to what you need to know. So thank you so much for joining me. I'm so excited about this. I'm excited to be in your space today. Remember that we're all in this together. This is a great opportunity for us to connect and to learn and to have something good come out of this process. So I look forward to hearing from you. Talk to you soon. Thanks.